bad. We're better than China, we're better than UK, we're better than the States in terms of prevalence of diabetes in the country. Okay, we are amongst the top 10 in the world. Okay, the population suffering from diabetes. Okay, so maybe we bad other things, but at least as far as diabetes, we're not bad. We're top 10. Okay, look at our color there. Okay, we're predicting more than 50% of the population are going to suffer from diabetes. And diabetes is a major risk factor for heart disease. In fact, some authorities are saying that if you have diabetes, it is as though you have heart disease. Okay, so be careful about diabetes and make sure it's well controlled. Another important reason why heart disease will increase in the future is the lack of physical activities, especially amongst the ladies again. Even amongst the men, but amongst the ladies more so. Okay, they're not just exercising enough. So, result that all these you put it together, you get a major epidemic called obesity. Again, in most developed and developing countries, emerging economies and all that. In fact, some people have even said that there's a comment which says that for the first time in this century, for the first time in the history of mankind, more people are suffering from overeating than people are actually suffering from malnutrition and undereating. Okay, because it's just too excessive food and this is okay. What's more frightening is this: children who are overweight, children who are obese, and that's an increasing incidence as well. Estimated 70 million children under 5 years of age who are overweight, okay, obese, and they will become obese into the adult. And it's a term nowadays called diversity. You see, there are two types of diabetes. Okay? Diabetes type 1, which mainly occurs in children, which get an infection and their pancreas, which produces insulin, cannot produce it because damage to the pancreas. These children will have to be on lifelong insulin injection. The other type, which is type 2 diabetes, previously known as adult onset diabetes. It usually afflicts those 40 years and above. As a result of there's enough insulin but just cannot act well with low blood sugar. It used to be common in adults, but now we're seeing younger and younger children, as young as 9, 10 years old, who are actually suffering from type 2 diabetes, which should actually be confined to adults. Okay. Why? Because of all this, the influence of fast food. Every time a new cartoon comes out, it will be linked to a fast food. Okay. You notice that or not? You go to a fast food restaurant, the waiter and waitresses will always ask you, do you want a large fry with that? Because they've been trained to sort of tune you to say, you buy this large fry and just pay an extra $1. You think it's a good bargain. Okay. It's available everywhere, 24-hour shops. And then there's no place now for, I remember our school fee was much bigger than this. We reduced to like half the size now. No place for physical activities. 24-hour TV, 24-hour computers. When school holidays comes, the children get the computers. They are now playing computer football rather than being out in the field playing football. Okay. Lack of eating time. And one major reason is this, the influence of fast food. Okay. Now I'm not saying that you can't. Okay. I still bring my children to fast foods once in a while, once every 6 months. For the last 2 years, we have been disciplined and we have only allowed them once every 6 months. We bring them, but we go along with them. We don't give them a free license or whatever. We go along with them and help them to make choices. Initially, they protested. They want to run away. They want to kill us and all that. If you are disciplined, you love them. You want to. This bottle of cola contains 54 teaspoons of sugar. Okay, 1 can of Coke, Pepsi, or whatever Coke it is, contains 9 teaspoons of sugar. You only allow 2 teaspoons of sugar in a day. Okay. And all the added salts and all that, and the number of calories. And because of modernization, you go to any supermarket, any shopping mall, I can bet you nobody will use the stairs. everybody will take up the escalator. And when the escalator breaks down, everybody will listen because it's so inconvenient to use all these things. Okay? That's the price we pay for modernization. Okay? Okay, the shop down the corner, we will not walk. Maybe because of the temperature, I mean the humidity of the thing as well. But most of us will not bother to take extra steps. Another major reason why heart disease will increase in the future as well is this: children who are smoking. You see now, in my time, you will know who are usually confined to secondary schools, but now primary school children who are also smoking. For a parent who smokes in the presence of a child, by the time he's 5 years of age, the child will have smoked about 102 packets of cigarettes. And this is not something that I looked up. This comes actually from World Health Organization, World Heart Federation, Science, epidemiologic studies have been done. So what are the symptoms? The most common symptoms of heart disease is chest pain. Okay. The diagram which I show here is where the pain usually occurs. Because it's central, so you'll feel central kind of tightening pain in very severe cases as though it's going to be life is going to be taken away from you. Okay. It may radiate to the jaw, may radiate to usually the left shoulder, but also the right shoulder, and can also even go down to the upper abdomen. And that's where a lot of people get confused. They think it's gastric. Sometimes when you go to doctors, they will also tell you that you need gastric. Now be careful. If you not had in all your life, you've not had gastric before, just pain in upper abdomen here. Don't just dismiss it as gastric. Go and see a doctor. And then if he tells you it's not, go and get to see someone else, get a second opinion. Go for a thorough heart examination, because even if it proves that it's gastric, that's fine. Okay, treatment is there. But if it turns out to be a heart problem, you actually suffer a heart attack, then it's sad. Okay. Some people do not have chest pain. If you're diabetic, chances are you will not suffer the classic symptoms of chest pain. Okay, suddenly you have a heart problem. Okay, so they will call it as shortness of breath. In Penang, in the Chinese speak Hokkien, so it's called chuan. Or what do you call it in Cantonese? I forgot in Cantonese. Even then also I learned the bad words. What do you call it? Shortness of breath. I'm sure you've had stories, you know, relatives, friends who one day they were here, the next day they're gone. Because lo and behold, people say he died of heart disease or heart attack. Now, if you're asked to give a talk right in front here, like what I'm doing now, make a bit of documentation, okay, that's quite common, that's fine. But if you're in the office quietly, the wife is not disturbing you with that, you get a bit of documentation, you might have to be careful, okay, take that too much. So what do you need to do? You need to do battery of tests to confirm that it's heart disease. I'm talking specifically for heart disease. Okay, there are a few blood tests as well. First of all, you go to a doctor to get a thorough medical examination, do the ECG, stress test, 64 snacks, and these are all not necessarily done all at the same time. There are indications for it, okay, and your specialist will do it. I would advise, if possible, go and see a specialist, but if you have a family doctor who knows you as well, you can do the preliminary examination and all that, and if it's required, you will refer you to a specialist. Here is quite easy. Most of the private hospitals will have it, the general hospital will have it, or even now that is a long queue. IGN you can, but it's a long queue as well. Or even the university hospitals. Okay? So this is a stress test. What you do is you run a treadmill, you get connected to a series of wires, and this ECG changes at the time of rest and the time of stress of this. An echo is basically a TV or camera which is placed on the chest, which will enable us to look inside the chest itself, inside the heart itself. So you see the valves, you see the wall that separates between the right side and the left side of the heart, and this patient has actually got a hole within the heart. Okay. Some of us may go around with a hole hole in the heart without even knowing it. Okay, that's also quite, I would say, fairly common as well. And then we have more specialized modalities of investigation, which includes this is what we call a 64 slide scan, which will enable us to visualize the blood vessels in the heart. But the most accurate examination is what we call the angiogram. Not all of us, not all of you, or not all patients who require an angiogram. Based on certain indications, the doctors or the specialists will advise you to undergo an angiogram. This basically, you place a wire which is threaded up to the heart, the blood vessel goes up to the heart, the dye is injected, and it outlines the blood vessel. So, part of the management, part of the treatment of patients with heart disease, a major portion is to control risk factors. We talk about the major risk factors, which include high blood pressure, okay, diabetes, cholesterol. Obviously, you have to stop smoking, reduce your weight, and exercise. Now, diabetes, high blood pressure, each will have its own specific medicine for it. Okay? Sometimes you may require 1, 2, maybe even 3 medicine for it. Some patients, they will take home a sack full of medicine to control all these diseases. Okay? So what I'm trying to say is that heart disease is as a result of all these major risk factors. Okay? Until and unless you are able to control these risk factors, you won't be able to control heart disease. Okay? Now, if giving medicine is not enough, the patient still complains of chest pain, or the patient complains of tiredness and all that, then the next step is to perform what is called an angioplasty. An angioplasty can be done either as a balloon angioplasty, that is, you blow out the catheter, it's blown up to open up the narrow segment. But studies have shown over a period of time, within a couple of years, that segment will narrow back again. So now, the doctors will place stents within the blood vessel to support the heart, to support the narrow segment. Okay? Now, these stents is much like a spring in a ball pen. Okay? The difference is that the spring in a ball pen probably costs about $0.25. There's such things as $0.25. These stents can easily cost between 8,000 to 12,000 ringgit okay, per stent. This is my area. Just going to show some scenes within the operation theatre. If you're screaming, sure look. Because we don't have any ambulance to bring to the hospital. Everything thought of, apart from that, you can have an ambulance and now, cardiac surgery is much like preparing for a flight. You want to take off and you want to land safely. Okay? So there are a lot of people involved. You got the anesthetists, you got the nurses, all the anesthetists are all specialists trained in cardiac surgery itself, in cardiac anesthesia. This is putting the patient to sleep. The monitors in the background there will monitor the patient's beat to beat and the time throughout the period of the surgery being carried out. Those machines deliver drugs to the precise millimeters of whatever drug that's required to ensure that throughout the period of surgery the patient is safe. In most patients, in most cases, heart surgery is a relatively safe procedure. It's like undergoing, say, the appendix. It's got the risk is about going an appendix or even a gallbladder surgery. Okay. Of course, there are exceptions. I mean, many factors which contribute to the risk being much more higher risk. But in general, heart surgery is quite safe. Okay. Because of highly trained surgeons and other specialists, you've got all this high technology equipment available to ensure that the patient is safe. There's an echocardiogram looking at the heart. This probe itself costs about 300,000. The machine behind that costs about $1 million. Okay, so it's pretty expensive with that. Right? You saw it still okay? Can I